I want to reassure you first and foremost, we're here for you. We have been here for you. We've been seeing patients via telemedicine, providing virtual consultations, providing virtual medical follow-ups and prescription refills, and following along to monitor everyone's progress. So we're here, we're committed to your safety and to your health. Now, we're at a transition point. The governor of Connecticut and many other states are allowing a slow re-emergence and re-entry into the workplace. So let me tell you what we're planning to do here. So number one, patient safety is paramount. Patient safety is really the critical aspect here. Obviously, my staff safety as well. We're doing everything possible to ensure a safe, clean, sterile environment. Let me tell you how that's going to work. There are going to be some changes, and I think everyone is going to be adapting to whatever the new normal is. But at this state, we're going to only be seeing one patient in the office per day, and namely, that's going to be the surgical patient. The person coming in for the hair transplant will be the only patient that we're going to be seeing. For years, my pattern has been to focus attention individually on one patient per day. Typically, we're seeing patients in the morning, the surgery is underway, and then the afternoon, I'm seeing follow-up visits. That's going to change, meaning that the afternoon visits will all be virtual. The risk of any cross-contamination in the office will be kept to a minimum because we're only going to be seeing one patient a day. That's the patient that we've arranged to do surgery for, that hair transplant that day. And what I'd like to sort of walk you through is when you come in for your hair transplant procedure, ideally this is how it will unfold. Call the office from your cell phone in the parking lot. One of my staff will come down and meet you at the front door. We will have the elevator wiped down and sterilized, and all the buttons will be clean. You come up the stairs, we'll take the elevator, we'll meet you. You'll come up to the 4th floor where my office is. You'll be greeted. The only difference, you'll see our smiling faces behind a mask. We're attentive. We really want to provide the best possible service and the best, most personalized care and aesthetic result possible. And I think we're going to be staying with the highest standard possible. The difference is, as a patient, you'll be seeing us. We'll wave to you when we put our masks on, and that's really what you're going to see. We'll be wearing gloves and the right personal protection equipment, and we'll also provide hand washing for every patient that walks in the door, as well as a mask and gloves for that patient. We'll bring you back to take photographs in a clean, wiped down, sterilized room. We'll come up with a plan. We'll draw on a plan that you agree with, and we'll look aesthetically exactly what you're hoping for. When we then walk back to the procedure room itself, that will be wiped down in our typical sterile fashion. Again, the difference will be all the staff that will meet you will be wearing masks, gloves, and a gown throughout the day. But the procedure we expect will unfold as flawlessly as we've been doing for the last 20 years. I do want to assure each and every one of you that we're going to be providing personalized, safe, expert care. I think this is the next level of attentiveness, and in some ways it'll become even more personalized. You'll be the only patient in the office. I will be screened. My staff will be screened on a regular basis. I would ask you, as the patient coming to my office, to let me know. Take your temperature at home for the 2 or 3 days preceding the procedure. In the office with me, we will actually measure your temperature. We're going to measure your oxygen level with a pulse oximeter on your finger. So we're going to be screening you. We're going to be screening all of our staff regularly, and we want to ensure a safe, healthy, successful environment for everyone. I look forward to working with you. Thank you so much.